Attending and being with us today. My name is Stephanie Mace, and I'm Vice President of Strong Communities at United Way of Metropolitan Dallas. I'm also a member of the leadership team of the Dallas Coalition for Hunger Solutions. In 2011, the Texas Hunger Initiative joined with Congresswoman Eddie Bernice Johnson and multiple public and private entities to organize the first Hunger Summit in Dallas. The goal was to inform the public and concerned leaders about the problem of hunger and food insecurity, and to invite everyone to be a part of solving hunger in North Texas. Since then, the Dallas Coalition for Hunger Solutions was established and has brought together over 250 organizations and individuals to develop ideas and implement strategies to reduce food insecurity. Annually, the Dallas Coalition for Hunger Solutions continues to hold the Dallas Hunger Summit. We would like to pause for a moment to thank the members of the Dallas Coalition Hunger Solutions leadership team for organizing this year's summit and for providing direction to the coalition. The mission of the coalition is to empower all Dallas County residents to gain equitable access to healthy food. The work of the coalition is carried out in its 5 action teams. They are child hunger, senior health, faith community hunger solutions, public policy and advocacy, and urban agriculture. And you can see the 5 and a description of all 5 of those on your screen. Access to healthy food is such an important issue for our youth, families, and older adults. We know that too many of our neighbors are struggling with having enough nutritious food to eat. Access to a good nutritious diet keeps us healthy, and a poor diet or a lack of access to healthy food can lead to disease and health disparities. Today and over the next 2 weeks, we are going to examine how to create a more secure and just food environment for everyone through the lens of our top 10 hunger solutions. As with every problem, food insecurity is complex, and it is not as simple as providing food. Rather, we need to collectively work on all 10 of these approaches. And we've listed out those 10 that you see on the screen right now. Speakers from across multiple sectors will discuss how to solve hunger and impact community health in this all-inclusive way. We will hear about innovative efforts underway in our communities and learn about policies that increase access to nutritious food and support optimal health. We are recording today's presentation, and you will receive a link to the recording and a follow-up email in the next few weeks. At this time, I'd like to recognize Congresswoman Eddie Bernice Johnson, who is in her 15th term in Congress representing the 30th Congressional District of Texas. She was instrumental in launching the coalition, and as coalition chair, her support has made the coalition's accomplishments possible. We are honored to have Congresswoman Johnson with us in person this morning. Welcome, Congresswoman. Thank you so much for being here today. Oh, I think you're on mute. Oh, we still can't hear you.
Am I okay now?
Yes, ma'am. We can hear you now. Thank you.
Thank you very much. And let me say good morning and thank you for tuning in to our first webinar for the, did you say 10th or 11th annual Hunger Summit? Oh, I can't hear you. Okay. But I want to express my appreciation for all of those who are appearing today and all that you have done to address this issue. I really believe that we've made real access for many, especially our children, to healthy foods this past decade. All of this has been made possible by the involvement and commitment of many great organizations and community leaders from across North Texas. To recognize the 10th year of this event, the Dallas Coalition of Hunger Solutions has developed a top 10 list of hunger solutions that we can alleviate hunger in our community. And we're proud about that. There are 3 sessions to this year's Hunger Summit. And through these sessions, we will discuss just how we can solve hunger and improve community health in an all-inclusive way. And I hope to be able to assist with that, with what we're struggling with on a daily basis in Washington to get more resources for this very issue. We will explore the innovative and collaborative steps underway in addressing the items on the top 10 list, along with some policies that can help this goal become a reality. Today, we will look at how we can address our hunger with a holistic approach, focusing specifically on insights and lessons learned during the COVID-19 pandemic. The COVID-19 pandemic, which we continue to deal with today, has highlighted how large of an issue hunger is, and not just in our community, but across the country. As I've said before, hunger is not just an issue of economics and income inequality, but also a public health concern. We are all familiar with the statistics regarding hunger and food insecurity here in North Texas, and you've seen many efforts recently during this pandemic by generous people and organizations across the whole area. We all saw that on a full display last year during the early days of the pandemic. Now, as we continue to recover, we have a chance to build a better system here in Dallas to address food insecurity. In Washington, we are working hard to address hunger in various manners, from the Biden administration, increasing SNAP benefits amount, to the House Rules Committee Chair, Jim McGovern, bringing attention to the issue of hunger through various committee events. He took the mantle of leading Stop Hunger Caucus in the Congress. We all want to work harder to find these solutions so that no American, adult or child, goes hungry. It is my hope that discussions we have today and the sessions over the next few weeks will help light a path to a future where no individual goes hungry. So I want to thank every individual for taking your time to be involved in the solution. So thank you very much and have a great meeting.
Thank you so much, Congresswoman. We really appreciate you being with us this morning and for being a champion for food security in DC, representing us, and then also in Dallas County. Right now, we'd be giving you a warm round of applause. Thank you so much.
Thank you.
It is encouraging to be with so many community leaders and organizations this morning as we discuss how different sectors, including technology, business, government, faith, healthcare, nonprofits, and education might work together to improve food security in Dallas. Before we get started, I would like to thank the organizations that have provided financial support to make this event possible. Many thanks to our 2021 sponsors, who include the National Council of Jewish Women of Greater Dallas, Episcopal Diocese of Dallas, North Texas Food Bank, and the United Way of Metropolitan Dallas. We appreciate your continued partnership in advancing food and financial security for all of our neighbors. Thank you. Now to the part of the agenda that we've all been waiting for, Ending Hunger in America, a Holistic Approach. It is my pleasure to introduce Dr. Valerie Stone Hawthorne, our moderator this morning. With a PhD in cancer and cell biology from the University of Texas MD Anderson Cancer Center, Dr. Hawthorne transitioned into hunger after recognizing the overlap of cancer with nutrition, health, and the population of people in need. She is the Director of Government Relations for the North Texas Food Bank and is also a member of the leadership team of the Dallas Coalition for Hunger Solutions. Dr. Hawthorne will introduce our distinguished panel. Without further delay, I'll turn over the virtual floor to Dr. Hawthorne.
Thank you, and thank you for allowing me to host this and be a part of this wonderful event. I can't believe it's been 10 years, but here we are. So let me introduce the amazing and vast panel of speakers we have today. I mean, if we've got a lot of solutions for hunger, we need to have all the experts in the room, and here they are. So first, let me introduce Trisha Cunningham. She is the president and CEO of the North Texas Food Bank here. It's an anti-hunger nonprofit focused on eradicating hunger in the 13 county service area that we serve here in North Texas. Through direct services and feeding programs, she leads the NTFB team of 180 employees and thousands of volunteers. Last year, we provided 126 million meals across our service area. She currently serves as the board chair for Feeding Texas. And in 2020, she was named the Dallas Business Journal's 2020 Women in Business honoree, the 2020 Most Inspiring Leader, and DCEO's Dallas 500 Most Influential Business Leaders. We also have with us Dr. Phil Wong, a medical director with a master's in public health. He is currently the director and health authority at the Dallas County Health and Human Services Department. Prior to his leadership, he served on the medical director and health authority for the Austin Public Health Department. He also has previous experience studying and fighting and investigating infectious disease outbreaks as an epidemic intelligence officer for the Centers of Disease Control and Prevention. Dr. Wong is at the forefront efforts to manage and curtail the COVID-19 pandemic in Dallas County. And off script, I just want to say thank you so much for your leadership and everything that you have done for us during this time. Gloria Smith is the Associate Vice Chancellor in Career Connected Learning at Dallas College. She's a first-generation Career Connected Learner and college graduate. She's passionate about serving underrepresented populations and creating an innovative, collaborative solutions to address racial, income, and educational inequalities. She's at the forefront of transforming higher education to serve non-traditional college learners. We also have with us Jennifer Sanders. She's the executive director and co-founder of the Dallas Innovation Alliance. They are a 501c3 public-private partnership dedicated to supporting the design and execution of a smart cities plan for Dallas. And while at the DIA, she has collected a network of 36 member organizations and works with over 20 departments within the city of Dallas on projects related to equity, mobility, digital divide, and public safety in South and Southern Dallas. We also have Danielle Ayers, who is Minister of Justice for Friendship West Baptist Church, and pardon me, it should be Reverend Danielle Ayers. She mobilizes and organizes the church and community around social and economic issues such as wrongful convictions, mass incarceration, predatory lending, zoning, food deserts, and that's just to name a few, and oh, those are also important. She leads the Village Co-op, a community garden and fair trade justice program, and a supply chain support for farmers. We have Kate Zelke, who is a principal transportation planner for the North Central Texas Council of Governments. And I learned the other day that you guys just say COG, so I may start saying that. It's a mouthful. The Metropolitan Planning Organization for North Central Texas. She leads the Equity and Environmental Justice Program for the Transportation Department, overseeing initiatives seeking equity in the transportation system for people of color and others who have been historically underserved, marginalized, and adversely affected and by persistent poverty and inequality. And finally, we have Matt Garcia. He currently serves as the Senior Vice President of Public Policy for the Dallas Regional Chamber, one of the largest and most established business organizations in the state of Texas. Mr. Garcia leads the policy efforts for business priorities through issue advocacy, member education, and collaboration with regional partners. He previously served as the Chief of Staff for U.S. Congressman Pete Sessions, and we are so excited to have everybody here today. I cannot think of a more robust panel that I have ever got to witness, hear, and be a part of. So I'm so excited to have everyone here and start this conversation. Speaking of conversation, I invite all of you to put some questions in the Q&A. Go ahead and hit up the chat. You know, these are much more interactive and robust the more that our guests participate. So we want to hear your thoughts and we want to hear what you're thinking. So to kick us off, I'm going to do this in kind of a conversational style. I will address one of you to answer a question, but after they're done, you are more than welcome, any of the guests, to chime in, especially if it also fits into the area of your expertise. So I will start this panel with kind of the number one question on so many of our minds, addressed to Dr. Phil Wong. So through the medical and community response of COVID, you know, it's been at the forefront of your role for the past year and a half. And we would really love to see how you have seen inadequate nutrition or good nutrition factor into the COVID pandemic. Would you share your experience with us?
Sure. Thank you for the opportunity to be on this panel and to be with such a great group. This is, obviously the COVID-19 has dominated all of our lives for quite some time, and certainly nutrition has a huge impact on what we've been seeing with this. From the start, it's been disproportionately impacting certain populations. Some of those that are most vulnerable, those have been certainly older persons, but then underrepresented, populations in minority populations, those with underlying health conditions. And so that disparity, can be also very much linked to the nutrition that we've seen, and those disparities that we've seen throughout Dallas County and other areas that reflect, whether I think the hunger and nutrition are a key element of that disparity. Persons with poor nutrition have higher rates of obesity and diabetes, and those have been two of the biggest sort of risk factors for more serious illness, as well as, when you look at the impact and the sort of response even to vaccinations and things, having a strong immune system is very much impacted by nutrition and diet. Absolutely, differences and disparities that we see in nutrition and in hunger have played a big role in some of the differences that we've seen in the impact of COVID on different populations.
Absolutely. You hit the nail on the head that the very same population of folks that are having the worst response to COVID-19 viral infection are those that have the same symptoms of hunger. So thank you for connecting those two. It's a critical point. The next question I want to ask is, I'm going to address Trisha Cunningham. So the food bank and the network of community food pantries became frontline responders during the COVID crisis. In fact, I see so many of them on the line here. There's Crossroads and Sharing Life and City Square and Community Lifeline and Brother Bill's and Ascension. It's like we have all of our partners here with us today supporting us. Can you tell us how and why nonprofits were able to rise to the equation as quickly as they did?
Yeah, thanks, Val. And I also saw so many of our partners out there, and honestly, a lot of it has to do with them, and I really talk about it in the 5 C's. It's commitment, collaboration, communication, connections, and compassion. So when you think about that commitment and collaboration up front, that's because in the nonprofit sector, we are here for our mission. Doesn't matter which nonprofit it is. I mean, people go there because they really want to make a difference. And we saw our partner agencies step up to be able to make sure no one went hungry. Our team at the food bank stepped up to make sure that no one went hungry. We saw our community members step up. So it's that really deep belief in what we do. Number one is really how we were able to activate and make sure that we were able to stand on those front lines. We've never, ever seen this in our lives, that this need would be here, and we hope we never see it again. There wasn't a playbook. I can tell you we've tried to document a playbook now so that we have it going forward. But number 2, communication was key. There was just so much uncertainty. As I said, we didn't have a playbook for this. We hadn't done it before. First thing we had to do is we had to organize ourselves internally. Who do we have? What do we need? What are the barriers? Where do we need to go? Give people permission to take action. And it's okay if we make mistakes along the way. We will course correct, because certainly the intent's there that we will do. And we did make mistakes. I mean, there's things that we learned all along the way. We had to conduct needs assessments. We had to get input and feedback from our partner agencies. We had to figure out how to get the food we needed to be able to distribute to our community. Our community was in crisis. Things were shutting down. And we had to be able to figure out how to best serve them. And we had so many people that had never needed charitable food assistance before that didn't know how to access it. And so communication. In these times, you cannot over communicate. The next area, it was really about connections. So we had so many stakeholders and so many in our community that wanted to be able to help us and step up. And I want to really point out our elected officials with this. You know, I saw so much compassion from our elected officials. I saw so many people that they were hearing what was happening in their own communities, and they said, how can we help? What can we do? They really helped us and sort of provided that additional support that we needed to be able to advocate for that critical support that we needed from things like emergency funds, government programs that would provide additional resources into the community, workforce assistance, and even the deployment of the National Guard. I can tell you that is something I never, ever, ever thought I would see in my lifetime, is looking out my window down at our parking lot at 6:30 in the morning and seeing platoons of National Guard form because we couldn't access volunteers and neither could our partner agencies. And knowing that they were here to help us in that fight against hunger was just such a relief for us, because we really could not have done it without the entirety of those government resources that we had. And then finally, compassion. And whenever I think about compassion, it's not only about compassion and people really caring for their community, but they took action with that compassion. They helped us to make sure that we had the resources that we needed to be able to fight this issue of hunger. So it's about the food and the funds and just making sure that everyone came together. We had corporations and other organizations and food drives and people using their talents to make, for example, photography of people on their doorstep during the pandemic, and then they would give a contribution to the food bank. We had so many people that were so creative to be able to help out throughout this time. And our food banks had to be really, and Food Network and our pantries had to be so creative during this time. And they also saw that outpouring of compassion with our community. I mean, really, that was the wind beneath our wings, knowing that our community was behind us and they really wanted to be able to help ensure that everybody had food on their tables during this time of crisis.
Yeah, I think that all of our Rolodexes, if that's even a term anymore for us older people, all of our Rolodexes just amplified that we had to work together as partners, or otherwise we weren't going to get the job done. So very, very good points. The next question I'm going to address Katie Zelke. And when we talk about hunger, it's typically in the forefront of our minds to think about emergency food pantries, community gardens, government programs, and other very in-your-face solutions that the Dallas Coalition for Hunger Solutions has spoken about before. So what I'd like is for you to talk to us about transportation. Yes, you need to be able to get to a grocery store to buy food, but it's so much more complex than that, the issue of transportation. So could you please tell us a little bit about transportation access, what that means to hunger, and solutions that are hidden inside of this really complex issue?
Sure. So transportation security is certainly necessary, not just to get to grocery stores or to get to a food pantry if necessary, but also to keep a job that helps you keep food on the table. And so in Dallas, 67% of workers that are below 100% of the poverty level drove alone to work. And this is according to pre-COVID Census Bureau data. 15% of that same group pulled to work and 8% took transit. So clearly there is a large reliance on automobiles, even for folks who are the working poor and living below poverty. So is there a way that we can create transportation security without folks having to actually travel somewhere? I don't want to step on Jennifer's toes because I know she'll talk about a lot, but is there a way to leverage the internet and broadband access, create equity in that field to help folks access food? And are there any non-traditional travel solutions that we can implement, such as microtransit?
Could you maybe tell us what does microtransit mean? That's actually the first time I've heard that term, which tells me I need to brush up on my reading.
Sure. So this would be like the GoLink services and the Zip Zone services and other door-to-door shared ride services that are being provided by transit agencies. So similar to the Ubers or the Lyfts of the world, but provided by transit agencies.
Okay. That makes a lot more sense. Thank you for sharing that. As we look at the way that, especially City of Dallas is unveiling a lot of their transportation plans that are coming up, always encourage folks to talk to your city council members, talk to people about what transportation access means to you and your community, because if we don't have the right stakeholders in the planning process, then it's really hard to develop exactly what is needed for specific neighborhoods and neighborhood situations. Let's see, the next question I wanted to ask is to Gloria Smith. So currently we are at the lowest unemployment rate since the pandemic began, which is good news, right? But in some parts of North Texas is even lower than pre-pandemic, but a job does not guarantee food security. Could you talk to us a little bit about how the education and training are vital for today's constantly shifting employment landscape?
Yes, so thank you so much for having me on the panel. Here at Dallas College, we recognize that there are jobs out there and available for individuals to apply for, and they can get those jobs. But what we're realizing is, especially for those individuals that are living below the poverty level, if those jobs don't pay a sustainable living wage, they are unable to take care of their families. They're unable to feed them. And so what we are trying to do to help them upskill is we've created some innovative solutions to provide them access to accelerated training opportunities that can allow them to compete for higher paying wage positions. We are working in partnership with employers to identify what their labor needs are, and working with those employers who are committed to paying higher sustainable living wages so individuals can feed their families. We're doing this all at no additional cost to students. And one of the things that I really love that we are doing now is we are reaching outside our traditional walls of the community college. You know, as Kate said in her comments, transportation is a huge challenge. And so we are bringing training opportunities to these communities. Some of these opportunities are being brought through investments in real estate leases with Dallas College, being the leaser, but the more innovative solutions are being created through our partnerships with community-based organizations that are, one of their primary goals is to address food insecurity. So we are trying to bring training and education to the locations where individuals come to take advantage of the food distribution centers that are there, so they don't have to travel multiple places to get educated, to get food and things of that nature. But all of those, working a low income job definitely has an impact on the choices you can make when you're going to the grocery store. And that has a ripple effect not only on the adults, but on their children as well. And so we are working to alleviate that. We have some innovative solutions where we partnered with the North Texas Food Bank to have food pantries on site for our college students, because we know that when they don't have adequate nutrition, it affects their ability to master the content and learn the skills that we're trying to teach them so they can get a better paying job.
Do you have any top of mind, I don't mean to put you on the spot, any top of mind, like a single success story, something that you could just highlight, even if it's an individual unnamed student or a program goal that you've seen achieved with this wonderful innovative programs that you've been developing there?
So I will say that, of course, our partnership with the North Texas Food Bank, that's a huge success. We have mobile food pantries that not only distribute food at our college campuses, but we have satellite location campuses, smaller campuses that are more community focused, where we have those same mobile food pantries go to those locations, and students can access food while they are in class. We have another very, very innovative partnership with the Regional Black Contractors Association that's focused on second chance citizens, but also outreaching and recruiting to bring in individuals who are underemployed and underemployed. And we are bringing them training opportunities, but our partner with the Regional Black Contractors Association, they also they provide students with meals while they're in the training experience. And sometimes providing that lunch meal for many of them may be the only nutritional meal they get per day. And so with that, we've had tremendous success. We've had 14 cohorts go through that program. We've got about a 75% job placement rate, but it's those wraparound and supportive services, and especially addressing the things such as, food insecurity that have contributed to the success of these models.
Absolutely. And thank you, Vice Chancellor, for those comments. I mean, I believe that the romance of ramen is over, right, for our college students. I hear a lot of nostalgic stories of, oh, well, I was hungry in college, but it's not acceptable, right? It's something that we've got to face. And we're talking about families that are in need, that are getting back to college, and not just, the 18-year-olds that need to tough it out, right? This is a new way of looking at advanced education. So thank you for that. Next question has been teed up by Kate, so thank you. Jennifer, I wanted to ask you, so following up on the innovation and the necessity on how to create technological equality for all communities, how do we identify and close those technology gaps to address the issue? What is planned for distributing the internet access, training, equipment, infrastructure all across Dallas that are really going to transform communities that are under-resourced, and how is that going to impact food insecurity?
No, thank you so much. And thank you so much for having me. I'm incredibly humbled to be amongst this group. And just quickly, I was at a summit earlier this week that was cities talking about solving big challenges. And we talked about that feeling of overwhelm. And these are just massive problems to solve, but how the critical nature was get all the experts, get everyone in a room to pick what is the highest and best use of my skills and my focus and my treasure, and then we can solve them. And every element that surrounds food insecurity, that surrounds transportation, it's all interrelated. And so I just want to say I'm very humbled to be amongst y'all, and we're all necessary, all of the different skills and initiatives, and those partnerships has been already discussed. So, but I think, we've been working on digital divide specifically for about 5 years, and so certainly pre-pandemic, and what we found in our initial research, as many do, is it was no surprise that where there are digital deserts and lack of access to high-speed broadband, there are typically also food deserts. The proximity to transportation, to food, to health services is more challenging in all of these areas. And that's not a surprise. It speaks to, we can find innovative solutions to solve for each of those in part. And the way that we looked at the Dallas Innovation Alliance, some of y'all are partners with our mobile learning lab, which is the Wi-Fi bus that goes in parks in underconnected communities to provide Wi-Fi, but also enrichment activities for the homework gap. And that concept was never meant to be the permanent solution at all, but we know that kids can't wait to be able to have that access. And this is pre-pandemic, we looked at that. And I think similarly with all of the work that groups have been undertaking, that concept of mobile access, whether it's food, whether it's health services, whether it's vaccinations, is an incredible way to meet communities where they are in the short term until we find the big systemic solutions and brick and mortar solutions, which we know take a great deal of time, as does laying fiber in the ground, which is the ultimate goal that takes time. So sorry to back into your question. The pandemic certainly provided a lot of resources financially to be able to solve problems quickly in the short term. And I think, as we all know, Dallas ISD did an incredible job with hotspot distribution and device distribution. The city of Dallas has a large supply of laptops and hotspots in the library systems. And so from the standpoint of how do we get everyone connected in the very, very near term, the mobilization of efforts, I've told public entities, I have never seen two public entities formalize an agreement with lawyers, come together, make purchasing decisions, and get things on the street as quickly as I did last year. And so, between them and the hundreds of community organizations necessary for that distribution. If you're having internet problems, how are you going to have the communication and to the supply chain, if you will? And that applies to the whole food distribution network as well as within the internet itself. And so we talk about the three legs of the stool: access, affordability, and training. And so the access is physically getting internet into homes. The affordability, which sometimes we have to take the statistics we know, which is the Federal Reserve Bank found that Dallas has the 6th worst in-home connectivity rate in the country amongst large cities. We do not like to be at the top of the list for any of these factors, but a lot of great work is being done in that space. But affordability, to understand, is it an income issue or is it an access issue? And so the City of Dallas and Dallas Independent School District undertook a large strategic plan to help identify, 1, where all of the assets are, 2, how many subscriptions are being undertaken, and where is the line between, is it an affordability issue, is it an access issue, is it a training issue? And there are a lot of great programs going on around those digital skills bootcamp training, around supporting parents on how to get their kids online and support them in remote learning. And there's actually a program we're working on with the United Way, the State Fair of Texas, Power You Up, City Square, to be able to give free digital skills boot camps and then case management to then place therein.
Yeah, I think that the stories that everybody heard during the pandemic highlighted this massive technology gap problem that Dallas had when it started. There was, I can't remember which station it was, but they were in a McDonald's parking lot interviewing a mom because her kids were sitting in the back seat trying to connect to the free Wi-Fi that McDonald's was offering so that they could get their schoolwork done. And when you look at the city of Dallas that has so much, how in the world is this happening? And so to your point, I think stories like that really helped mobilize organizations to say, we've got to close this gap. I mean, come on, it's 2021. How do we get better at that? So thank you for all the work that you're doing on this. I mean, you guys are one of the forefront leaders, and I hope that other areas of the country take notice of what's going on. The next question I wanted to address to Reverend Daniel Ayers. So thank you for having some of your passions, as well as like being community garden. I noticed that we had Betty Montgomery on the call with the Oak Cliff Veggie Project, one of my favorites down there of community garden led work. So the pandemic shed a new light on the disparities and inequities in certain communities. Could you share with us some of the increased needs that you've seen over the past year and how the faith community has really risen to fight and solve hunger during the pandemic time?
Yeah, so good morning to everyone. It's so good to be on this panel. This is a very robust panel and I'm learning so much already. So it's always great to be with so many others who are in this work to really deal with hunger and all of its complexities, right? It's not just one area that we can focus on. So thank you for the question. So I think the role of the faith community has, for me, at least in my experience and historically, has always risen to the occasion of meeting the most immediate needs of community, those acts of compassion. I feel like faith communities have been deeply engaged in, and obviously with the pandemic, many who were already teetering on the line, right, of being food insecure, not having access, obviously, fell over into really becoming food insecure, not having access to food. So I think the role of faith community is what we've always done. But I think what I also saw in that moment, even with our own faith formula, which is our social service arm of the church, just the ways in which we were able to do more collaborative work that otherwise had not been done before, right? How we were able to collaborate with other organizations to expand capacity, to make resources more available and sharing resources, because people were looking for food from everywhere, right? How do we get enough to meet the demand and meet the needs? So I think this idea of really continuing to build partnerships and collaboratives to communicate with one another across the city on food distribution is certainly a role that faith community can play to meet the immediate need, right? I think we always have to engage in those acts of compassion, which I think we do very well in terms of having food pantries, the food giveaways. I mean, we just recently did a food giveaway this week on Wednesday, for example. But I also think the role of the faith community is also to look beyond that moment, right? Look beyond just meeting the immediate need, and that the faith community does does have and can play a unique role in really moving from food security to more food justice and food sovereignty, right? That we can play a critical role in understanding that it is important for us to think about food systems in a way that we have control over the planting, the production, the distribution, and consumption of the food. So it's like, how do we also build maybe a different structure, a different system by which we can have control over the food that we're growing and eating, right? To get away from more of the corporate food regime, if you will. I think that is a role of faith communities in ending hunger, as well as, right, I think you can't talk about food sovereignty and not talk about land sovereignty. And I think when we look historically at that, I think about Fannie Lou Hamer, we know her as one who was very deeply engaged in voting rights, but she also, before language was put to it, she was deeply involved in food justice movement. And so for her, it was about how do you get land to people so they can grow their own food. And so I think we have to look at land sovereignty as well. And what does that mean to really be able to own and control land use? Right. So I think the role of the faith community is also how do we become more engaged and involved in policy work, particularly land use policy and food policy. I think we have to, increase our IQ level as it relates to engaging in advocacy to change the structure as it is currently. And I think that is more of the advocacy work that we can do a better job at in terms of, advocating for circle protection around food budget items, from the city to the federal level. So I think role of the faith community, again, acts of compassion with that question. I saw that really just explode during the pandemic. And I love seeing how people from all walks of life really came together to make it happen, right? People were just doing all they could to share their resources. But I think we have to shift also to move from just the acts of compassion to the acts of justice, and that faith communities really need to think more deeply about food and land sovereignty as more of a permanent fix and not just, acts of compassion that requires us to continue to repeat these actions, but how do we develop a completely different ecosystem in which we can make food accessible to people in our communities.
Yeah, and I see so many in the faith community getting involved in that food sovereignty in the land availability and accessibility. And it wasn't really until I started diving deep into zoning laws that I was like, this is a complex issue that really needs adjustment. I mean, you can't, if the community wants to grow food on land that they own and there's no access to water, right? There shouldn't be so much red tape in the way to just get some water onto some property. So I appreciate the efforts that are being taken in the local communities who want to take on these initiatives and do what they want is best for those that they are serving. My next question goes to Matt Garcia, and we are right on time. So this is great, guys. Like we are hitting it right. So Matt, I think a lot of folks see the role of business in fighting hunger limited to only providing strong wages for your employees, right? Like that is your role in this space. But there's many other ways that businesses can really join and help out the health and nutrition of their employees in their community. So could you highlight some examples of how the business community should be fighting hunger and solving hunger as well?
Absolutely. Valerie, first of all, thank you for having me here today to be a part of this esteemed panel. There's two areas I'd like to focus on. First, there is a concerted effort from the business community to improve quality of life for all. At the Dallas Regional Chamber, it's not just businesses that are members. We've also brought nonprofit leaders to our board to bring these critical issues to the forefront for the business community. We know that the businesses that have been part of the Dallas Regional community for years know this, understand this, and have been tremendous corporate citizens. But we're also blessed because the Dallas region remains a top destination for corporate relocations and expansions. We've actually seen an increase in interest in the region during COVID, more than double than we've seen in the previous year. This is a real opportunity to engage these new business leaders and have them partner with great organizations like the North Texas Food Bank and others that are doing impactful work to improve access to healthy foods. And through COVID, more than ever, the business community has seen the need for a healthy labor force and the economic impact when this is not achieved. Second, the business community also can work to leverage the relationships with elected leaders to amplify the importance of hunger and food insecurity. We heard earlier from Chairwoman Johnson, and we're so fortunate to have her represent us here in Dallas, but there's so many others that we can work to influence. I think a common theme we heard on this call earlier is just the advocacy side, the public policy side. We are seeing more businesses advocate for quality of life issues such as telehealth and telemedicine, increased access to healthcare, because these directly impact their employees and their customers. So from Fortune 10 companies to small business entrepreneurs, there is a need and an opportunity to have all these stakeholders involved in this side of advocacy work.
Yeah, and thank you for that. I think a lot of us are grateful for companies that do put the health and nutrition of their employees at the forefront of that. And I think we're seeing, just from an HR perspective, this swell of companies realizing if you don't have a happy, healthy employee, you're not going to have a happy, healthy business either. So we appreciate all the work that the Chamber is doing to help navigate even the small businesses into how they can better address that. So next question goes to Dr. Fong. So diving more specifically into community health and nutrition, can you explain your experience about how the neighborhoods that individuals live in or their income levels influence the choices that they make about their health, and how that ties back to nutrition? I remember sitting at the last community health needs assessment reveal there at that Goodwill, I think is where they had that, and seeing that slide go up with the different zip codes and what the average life expectancy was, and just being floored at the gap. We're not talking 1.2 years or something. This was like a decade, right? So can you explain, why does where you live impact how long you live?
Sure. Well, exactly. With our work with Parkland on the community health needs assessment, we showed the gap going up to 23 years difference in life expectancy between some of the zip codes in the southern part of Dallas County, southeast part, and more affluent areas of Dallas County. And so it really relates to everything that we've been hearing thus far this morning. It's differences in transportation, education, job, workforce opportunities, technology access, food security. So all of these factors contribute to that disparity. And so that's why everything that we've been talking about, we need to make sure that there's access to healthy foods and built environment that supports people, safely being able to get physical activity as part of the day-to-day activity and other things. Again, all of these factors contributing, of which access to healthy foods is one of the key pieces of this.
Sure. I want to restate what you said, that you can live in the Park Cities and 75216, it was either 216 or 215, that was one of the worst. That is a generational difference of life expectancy, 23 years. And one of the healthy aspects of creating green space so people can get their exercise outside and do all of that, you also have to compound that with making sure it's a safe environment. My kids go to school down in Southern Dallas, and they're not even allowed to run at the park that's closest to them because it's not deemed safe. And so we've got to create environments that create healthy aspects for the community members that are there so that they can use those to better their own lives and not have to seek elsewhere for health and nutrition that's going to improve their lifespan. So Trisha, I'm going to come on back to you. So for the most part, we've seen the crisis food response of food distribution it's been going down as jobs are opening back up and people are returning to work and schools have reopened. So we have school meals put back into place for those children that are attending school, and there's volunteers returning to service, right? So there seems to be a light, right, from the COVID-19 pandemic. So what is the long-term outlook? And this question was in our chat too. What is the long-term outlook for food relief by nonprofits? Is there a new normal, or are we just going to be returning to business as usual?
Well, first of all, we are so grateful for all those programs that have been put in place during the past to be able to help people along, because we certainly would have seen food insecurity a lot higher if it had not been for the multitude of programs that were there. And we are extremely grateful to start seeing volunteers back. But I know with both us and our partner network, they're not back at 100% yet. And so we're still having to be very innovative and creative and making sure that we can continue to distribute food. What we're seeing is whenever you see those stimulus checks and things come down, the needs do go down a little bit, but over time they gradually come back up. And I talked to a few partner agencies this weekend that they said that they really have not seen that much of a decline. One of the things that we learned very on during the pandemic is that people will be going into their resources, even if they have a significant change economically, whatever resources they have, they go to those first before they ask for extra help. And so they need to rebuild those resources. So I really don't think it's going to be business as usual. I certainly hope it's not business as usual. We've always used that moniker that we're only one paycheck away from a crisis. But guess what? We saw that firsthand during the pandemic because so many people that had jobs that were making it from week to week never thought that they would need additional assistance, had to ask for help. So the pandemic both exposed and created hunger. And we're going to have to be there to be able to help ensure that they can get back on their feet overall. So let's talk about that business as usual. What does that look like? Well, number one, there's no way that any of us can go back to the way it was before the pandemic. First of all, we have a responsibility to take the learnings that we've had and try to make sure that we can feed people in a different way, in ways that they need to be fed, and making sure that we can do that safely and more efficiently overall. We want to try to get as much food out into the community as fast as possible to be able to meet that. I mean, that emergency food assistance, we've been on that front line for so long, but I think this type of pandemic really shifted how we looked at that and how we could see our response. So I certainly hope that everyone, all nonprofits, take these learnings and implement, because we're going to be a stronger network of nonprofits overall. Second, I just don't want to take a step backwards. I really do believe that because of the compassion of our community, that we had the resources that we needed to ensure that no one had hungry, and that's the government resources as well as those who are in our community and the corporations and the collaborations that we had. And so we actually just launched a new campaign on Monday that really tries to amplify the impact that we can have in the community overall. We don't want to go backwards. We don't want people to go hungry just because we're moving beyond the pandemic, because there was a hunger gap here in North Texas before the pandemic even started. And so now we want to ensure that whatever that meal number is, that us and our partner network can try to make sure that we're meeting those needs in our community. But the other thing that we want to do, so that's number one, we call that sort of food for today, but we also want to provide hope for tomorrow. And we have a lot of our partners in our network that are providing some additional services to those clients that come to them to be able to ensure that they can get beyond their issue of food insecurity. I just met with a partner agency this week, and that is exactly what they specialize in. They said that most of the people that come to their agency are only there for about 3 to 6 months because they've had a critical issue and they need to work beyond that. And they help those individuals work beyond what that issue is. And that's why you're seeing us move from these big, huge, long lines of cars. You may not be seeing that. We still do a few of those, but we're trying to push them back to our partner network because we know, number one, that is where they have that additional case management so they can understand whether it is a health issue and maybe there's something that they need from a health standpoint, or maybe they need some help with workforce development, or they need some additional assistance that's going to help them move beyond that issue of food insecurity. But what that also means is not only with our partner network, but we also want to make sure that we work with additional partners, maybe non-traditional partners, that we still know that those that they're serving, that the number one need that they have to move beyond that issue is access to nutritious food. We've seen that whenever we were initially working with Dallas College, that was one of the needs of their students to stay in school, was access to enough nutritious food. That's what we see with workforce development programs. Whenever people are trying to go and have a program where they can make a livable wage, sometimes they have to drop out because they don't have access to the nutritious food that they need, because they need to go and get a job so that they can try to continue to support their family. So they're never going to be able to break that cycle of being able to get to that livable wage. And then, you also just see financial stability and so many other issues. It's so complicated what we deal with here in this hunger space because there's so many reasons why people are hungry. But we want to focus on our core competency of food, and we want to be able to help accelerate the progress that we can make in these root cause issues overall. You know, our partner agencies are so critical in this because they do provide that wraparound service. But we know that there are so many more in organizations that are already putting some wonderful work in place, that if we can continue to have our partner network connected with them, or if we can partner directly with them, we truly can make a difference in trying to increase food security in our region so that our entire community can thrive.
Right. I think in the nonprofit anti-hunger world, it's strange that your success is when you're not needed anymore, right? So helping stabilize families can help with that root cause of hunger. So excited for all of our new partnerships that are happening at the food bank, and we'll see so many of those unfold in the next coming years. My next question is to Reverend Daniel Oz again, and coming back to you. You know, we have a lot of community garden lovers on the call. I was running through I see, you know, Bob Curry and of course Betty, and I see Susan Alvarez, who has the task of trying to figure out a lot of this urban ag work at the city on the call. So we hear a lot about urban gardens and community gardens as a hunger solution. And in the southern sector of Dallas, we see multiple community gardens, but I think that there's 5 less than a mile away from Friendship West. I mean, that's great. Why are these gardens so important to the community? And how is a community garden empowering and different than a food pantry?
Yeah, thank you so much for that question, which I know can be answered so many different ways.
Right.
So many different ways. So I'll answer it from my lens and my vantage point. And I would love to hear from others too as well. So I think one of the things for me, at least in my experience, and I think Dr. Hong said this earlier, he alluded to how place matters, right? Place in the city matters to how well you will live, how long you will live. And so for me, community gardens, particularly in the southern sector, it does several things, right? And so I try to move from using the language of food deserts to food apartheid for me personally, because I think deserts always sounds so, it's not man-made, right? It's something that naturally that occurs. And so for me, I see that this access to food is a political act. It's very political. We know we can, you know, historically look at discriminatory political structures as well as policies, both past and present, that limit access to food and control of the food systems. And so for me, one is so important because it is a place where we can begin to empower ourselves, you know, to take the land that we do have access to plant, to grow. And for me, it's empowering because you can connect and have this relationship to the land, right? And for some people, what I have experienced who come out and work is returning back to that which they probably grew up, you know, in gardens and in the country when they were younger. But when they moved to the city, that left them. And it's a way for us to get younger people engaged and involved that then creates more community, right? And it also, for me, in some spaces, it turns what was blight, what seems to be not life-giving, when you see things growing, right? You see greenery is growing, it's something you can touch and you can feel that you were a part of, and you're able to grow that and then be able to consume that, right? And I think it also promotes healing in a way, where communities can come together, talk, and information can be transferred from your older generations to younger generations. We've had transgenerational conversations in the community garden to talk about the importance of food, importance of nutrition. And we've also, you know, set up a small mini, I don't want to call it a farmer's market, but it's certainly a place where we grew, harvested, and then sold produce. And in that moment, we would pass out cards, like if it was whatever vegetable it was a nutrition fact attached to that card, as well as a healthy eating recipe attached to that card. So it also gave us an opportunity to have conversation around not just growing the food and taking it home, but what do we do with the food once we get it home, so that the nutrition is not perhaps, you know, cooked out of it, or you are clear about what this food can do for you and your family in terms of nutrition. So it was both a nurturing place. Community gardens are also a nurturing place for community, as I see it and have experienced it. But we also can't talk about that, particularly in certain areas, community gardens as being a way of dealing with hunger without talking about environmental justice, because it wouldn't be enough to grow the food if, you know, water is contaminated or air is contaminated. So we've had a case, I've had a good friend who pastors a church, whose water supply was switched over, and the water became contaminated, and a member of his church was diagnosed with cancer and was trying to adjust their eating habits and buying, you know, fresh vegetables and fresh fruit, not realizing she's washing it in contaminated water, right? And we look at Shingle Mountain, and you talk about the pollution in the air. Well, we're trying to push healthy eating, but, you know, now I'm on all this medication because the air is so polluted and contaminated that now it's become toxic for me. So for us, the community garden is, yes, it's a way of, on a small scale, providing healthy, nutritious food, but we also have to look at that intersection of environmental justice in many of our areas as we try to grow these community gardens. Are we sure that the water, you know, is not, the air and the water is not contaminated? But I love community gardens. It's a place where I go just to be. So I think they're also healing, as well as a way of addressing, making sure food is accessible to people and people controlling that. It is a form of an ecosystem that can be created that I hope we can scale, right? Because as you know, we need more than all these smaller community gardens to really deal with the food apartheid that takes place. And how do we scale that then to move into a grocery store where we're growing the produce locally and feeding that grocery store in those communities where we can kind of maybe partner with other gardens to expand that, right? Where maybe some gardens are growing one particular thing and another is growing another particular thing, so that we can certainly build our capacity to do that. So that's how I would answer that question, how we eliminate this food apartheid system and create these nutritional, these communities where nutrition is certainly at the top of that list, but making sure that when we're growing that the environment is also safe to do so.
And I really appreciate you being one of the leaders in changing the narrative, right? Just as you said, the term food desert is a passive word. It's just, it happens to exist there. So no, using words like food apartheid and food sovereignty, food justice, environmental justice, I've always said that if it's making people uncomfortable, then you're probably on the right track. So I appreciate you switching the narrative so that we can start really addressing, and not even start, right? Folks have been working on this really hard for a long time, but really bringing it to the forefront to have these really difficult conversations. Speaking of difficult conversations that we've had in the past couple of years, so Matt Garcia, this next question is for you. How does diversity, equity, and inclusion in the workplace influence food insecurity?
Oh, Valerie, thank you. That's a great question. One, representation matters. When you have a C-suite or a leadership team that comes from diverse backgrounds and diverse experiences, this fosters an environment that brings more awareness of disparities in our community. So when you're an employee, a young employee, and you can look up at your leadership team and you see a Black executive, a Latino executive, a strong female leader, that we've seen that gives more empowerment to these employees to share their issues, share their priorities that are important to them and their neighbors. We have one of the most charitable business communities in the nation here in Dallas, and you're seeing more investment in our underserved communities to drive real change. But it's not just writing a check. You're seeing real human capital investment to drive change. For example, at the DRC, we've created an entire DEI team to focus on these issues, such as housing, food insecurity, to further amplify the work we've been doing in education, healthcare, and workforce development. This team serves as a bridge between the community and our business community to better solve these quality of life issues.
Sure. The business community is making great strides. And I think that it was quickly realized that if you don't get on board, then it's just not going to be good for your organization. The time has come, right? So next question is, well, we don't have any elected officials currently on the panel. I tried to tap Congresswoman, and I think she's away from her computer right now. So I'm going to kick this question to Katie, but then I want anybody else who wants to elaborate, please join in. The past year and a half, we've seen rescue packages, stimulus checks, eviction moratoriums. How critical has the government response been to fighting hunger related to the COVID-19 pandemic? And I'm sorry, I said Katie. Kate, this is yours. Didn't mean to say Katie.
Sure. So certainly the government absolutely has a role in that. And the current administration has an executive order that calls for executive departments. So that would include the Department of Agriculture, the Department of Transportation, to address inequities, both based on race, but also on poverty and other factors that contribute to hunger. So here at the Council of Governments, to maybe shift away from just the pandemic and go back to food deserts in general, we think that it is our responsibility as the Metropolitan Planning Organization to address hunger that has not yet been addressed by the private sector in terms of food deserts that exist because there are not grocery stores in those areas. We have obligations under the Civil Rights Act and under environmental justice requirements to fight hunger. We do believe that there is an element of racial equity when it comes to food deserts. If you overlay the US Department of Agriculture map on maps of demographics, you'll find a strong correlation in areas where there are high percentage of communities of color. Whereas if you overlay that on poverty, areas of high poverty, but areas with low communities of color, you tend not to have deserts. So we certainly understand that there are policies such as redlining and disinvestment, also the construction of the national highway system that devastated communities of color, and also discrimination against Black farmers historically that have created these issues, and therefore it is government's role to address hunger.
Absolutely. Can anyone else talk about the government response that we've seen to fight hunger? Oh, Trisha, you're unmuted.
Yeah, I'm unmuted. I'd love to talk about this a little bit because like I said earlier in one of my comments, we could not have done or met the needs in the community if we had not had those additional government programs. And so I'm just, a debt of gratitude here. We advocated, we asked, and we saw response. But I think going forward, we have to remember that our community is still extremely fragile. I was so pleased to see that the recent enactment of the increase of the SNAP benefits. I think the first time in decades, there has been an increase in SNAP. They had the 15% increase for the pandemic, but they've made a permanent increase of 25% starting this fall. And for those people that qualify for that, if you go out and look at that schedule, most of you are here because you understand about hunger, that, these are people that are extremely in need and they need that additional benefit. And even though cost of living's gone up, they had not made an increase in SNAP. So we're extremely grateful for that. We believe that is going to make a difference because as much food as we can distribute at the food bank, for every meal we distribute, SNAP can deliver 9 meals through an existing food network, which is very efficient for our community. And I think the other thing that, I believe we've learned during this pandemic and just working with the USDA and Texas Department of Agriculture, just to be able to help us to be very nimble in how we respond in these times. So we had the flexibility due to safety issues to be able to have some different waivers, to be able to make sure that we could distribute government food that wasn't the normal way to distribute it. And, I'm hoping now that we have gone through some of these programs and we've seen the result that we'll be able to quickly have changes and processes to be able to ensure that we can respond and get that food to the people that need it overall. I know that there's also some additional programs that are coming up like the Americans Rescue Plan and things that are going to be infusing some additional dollars back into the community. We need to advocate and ensure that feeding and hunger is absolutely at the forefront of that because that is sort of a baseline need that our community is going to need to be able to heal from the pandemic and also to help our community continue to thrive going forward. So just a few thoughts on there.
Sure. And Jennifer, I see you're unmuted.
No, absolutely. And just to dovetail a little bit on what's happened and what's moving forward with federal funding specifically, the CARES Act allowed all of us to continue our work. And thank God for that, and continue to serving. And that money was meant to be short term, right? You spent it quickly, you put it where it needed to go. And these new funds that are coming down, the ARP money, the infrastructure plan, really look at generational long-term strategic investments. And so I think the opportunity that we've all learned from the pandemic, some of the new coalitions have formed all of these relationships, is to say, okay, now how do we solve 5 problems with this one investment? And so if you're thinking about putting in fiber, also repair other pipes. If you're looking at how do you put new development and where's the job training to ensure there's community gardens to, to look at the zoning implications of investments in capital infrastructure. But this is more money than I think we'll see in my lifetime, certainly, to do this. And how do we make sure we do it right? And to do it strategically, we all need to be at the table. And the good news is we are all at tables together all over the Metroplex. And so I know Kate and COG, we've had great conversations about what is the interrelatedness of transportation and internet. And then you add on to that access to food. And again, all the systems are interrelated. The funding is more flexible in terms of how it's spent. So I think everyone's speaking into what is going to set us up for generational success, whether it's training or technology or infrastructure. So everyone stay involved. It's very complicated, but I think if we all continue to talk about what are the ideas, what did we learn last year, and how do we go from Band-Aids to, again, generational solutions, I think we can see a lot of acceleration through this generous funding.
Yeah, Matt, I see you're unmuted.
Yeah, I just wanted to add to what both Trisha and Jennifer said about the ARPA funds, the American Rescue Plan Act funds. We have a really golden opportunity here because the legislature is set to convene for their 3rd special on Monday. And this is one of the priority items that the governor laid out. And there's about $16 billion that the state has to disperse. These are one-time funds. And if there are projects, if there are issues that we see as a community, as a region that we can highlight, talk to your state representatives, talk to your state senators, because they are looking for that input now. I mean, there's a finite pool of money, but there is competition statewide, and we as a region need to make sure that we are working collaboratively to highlight those projects to help solve some of these generational issues that Jennifer touched upon, because it's a really unique opportunity.
Yeah, and Dr. Wong, when I saw the amount of money that's coming into Dallas County, I thought it was a typo the first time I saw it. How is Dallas County looking to, are you still working on how to navigate this massive amount of funds to do the most good in the most places, or?
Yeah, I mean, I think that we are looking at a lot of the upstream issues, again, that the fundamental reasons why there are some of these, disparities just by zip code, all of those, some of that looking, I know we're working with the city on some of the investments in addressing homelessness. We're doing other things, upstream. We're looking at the investments to broadband access. We're also, before I came to Dallas County, I mean, a lot of the focus of the health department had been more on communicable diseases. I mean, certainly with COVID, that's, what we're needing to deal with now. But we are, we have it in our strategic action plan to really work also and develop the chronic disease areas, which, are usually some of the greatest killers, in our community. And so, we've been working to strengthen that chronic disease program, receiving some state funds for obesity, working on mini grants to some community partners for community gardens, increasing access. We're also, in part of the Build Challenge, Build Health Challenge with UT Southwestern and Dr. Pruitt, working with Crossroads, working with Parkland, and so have already been, some really, even despite COVID, successes there. Again, developing, having community health workers, working with Crossroads clients, working with the Parkland remote food ordering, so that the RDs at Parkland can directly order food for their patients, and the patients can go to Crossroads, pick up some of the boxes of food. But we are trying to, and also looking at the data to help with planning some of these interventions. So we are definitely looking at that, and a lot of the rescue funds also trying to support upstream interventions.
Right. I feel like we've been planning for the ARPA funds for so long. It's just like we're all waiting for it to get here, and how's it going to be dispersed, because there's so much good to be done out there, and we all have our strategic plans that we would love to see it go to. So thank you for all the work. This is kind of the last formal question, and we're going to go person by person to talk about, because I want to make sure we leave enough time for the audience questions, because I'm seeing some come in. So if you do have a question, make sure to put it in the Q&A, and make sure to highlight who you want to specifically address it to. So we just got through talking about the government, right? And the government is a really important partner in fighting hunger. But more importantly, maybe not more importantly, but equally importantly, our own partnerships here in North Texas. So I wanted to take a moment to chat about those. So Jennifer, I wanted to ask you, where have you seen successful partnerships in the anti-hunger space? Maybe just an example that you'd like to give.
I think so many are represented on this call, quite honestly. I think that the work that's been done throughout the region, some that have been done both in part here, and I've also seen expanded across the country, is the use of multimodal transit for food distribution, and maybe continuing that as part of the supply chain. So for example, when DART buses weren't operating in the pandemic, it shifted to delivering meals, and to similarly with Meals on Wheels, helping with vaccines. And so I think that partnerships that involve different uses for existing infrastructure or resources is something that we see around the country, and I think will continue. How do we use the vehicles already on the street in one way or the other from a carbon standpoint? How are we making full and best use? And so I think that's in a general sense, but also the work being done by the food policy led by UT Arlington that a lot of us are involved in. And that really looks at long-term, how are we putting all the pieces in place from A to Z? And that involves the city of Dallas and the county and the food bank and COG and folks like Restoration Farms and otherwise. But again, to me, it's about putting all the pieces together along the supply chain and using resources in different ways than previously happened.
Right. And Reverend Danielle, where are there opportunities to do better? Where can we better collaborate?
Yeah, once again, that could be answered in so many different ways. I'm sure there's a million different answers to that. And one of the things I want to say, this is also about collaboration, and Kate mentioned this in her commentary a moment ago. I think as it relates to making amends to the Black farmers, because not only the past discrimination, but currently, right? Because I think they can play a critical role in helping to build a sustainable food distribution network. And I've seen it happening on the East Coast with the Black Church Food Security Network, and the ways in which they're moving food through those various states to get to people who are in need of food. And also it's creating jobs in the process as they're using technology and transportation to really, build this independent food system. So I think one of the areas we can do some improvement on to collaborate with government and with, now I'm saying faith communities in particular can collaborate with government and other policy institutions, is to really turn from dealing with the immediate needs, but put a little more emphasis and focus on structural changes that are needed, right? So that food systems are sustainable and equitable and democratic, and that becomes more of the norm, right? As opposed to 1 and 2 here and there, but how do we really deal with the structures that are in place? So so many ways to answer that, but I would specifically now want to talk about we can do better as it relates to dealing with the structures that are in place. How do we, in some cases, maybe tear down and build back up again that's more equitable, right? In other ways, how do we might have to create a totally different system to deal with this? And of course, we've talked on this call, and everything is so interconnected. You can't, talk about food insecurity, not talk about living wage. You can't do that without talking about workforce development. I mean, it's all so connected, but I do think ultimately, I think we can do better. How do we radically reimagine what this food system looks like in a way that's most equitable for all people to be engaged, so that we're talking more reform and transformation rather than just transactional, which I think a lot of times we often engage in more. So, and I think that comes from social movements, and that comes from people like us on this call who do this work, how we push for real substantive change. And so that's how I would answer that question. That could be answered in so many ways and go on for at least another hour and talk about that.
Right. You know, ribbon cuttings are wonderful, but getting to those massive changes or do that long-term good. Trisha, I'm going to ask you this question, but it also can apply to Kate and Jennifer. So feel free to chime in after she's done chatting with this, but where can technology assist anti-hunger partnerships?
Oh, you know, you're speaking to my love language right
Yes,
now.
I'm speaking to the technological person.
So, you know, I had a 30-year career at Texas Instruments before I came to the food bank, and I'm all about technology and what we can do and how we can use that better in our fight against hunger as well. I think, you know, one of the things that just came so apparent to us is whenever we were feeding those long lines of people is that we really didn't understand why they were in that line. And so there's a couple of things that I think that we could really use and that would really help us in our fight against hunger. And there's already work being done on that, which is fantastic. The first one is service insights. And what that really means is, who are we serving? Why are they in need? What needs do they need to have met? How can we move them beyond their issue of food insecurity, and really having a more systematic way to be able to understand that, so that when we can see that there's trends, whenever we can see that, that is the basis of our validation of being able to put additional services in place to make sure that we can have a greater impact on our community overall. And, you know, we have really amplified our use of data analytics and really helping us to try to resolve this issue of hunger and making sure that we can do that. We're also leaning in a lot to our Feeding America network. There's 200 food banks that have service areas like the North Texas Food Bank across the country, and they are piloting programs, and we're involved in pilots of programs. For example, there's a program called Meal Connect that is allowing us to be able to receive food donations and making sure that we can get that to our partner agencies, and we're connecting those kind of resources, and that's going to be continue to be built out and be more robust. We talked about delivery of food. Dr. Wong, I know you talked about the Crossroads pilot there as well, but there's some additional pilots. Think about Instacart for food banks and for food pantries. So our pantries right now, there's a pilot I know Sharing Life is doing with an e-pantry program where clients can go in and they can do some case management online, but then they can also select their food needs and then go and do a pickup at a specified time instead of having to go through a line. And so that can totally transform how we serve our community overall. And then secondly, we've done some of our own work. It used to be that we understood hunger at the county level, but we know even within a county level that there are many different demographics and different, you know, economic needs there and cultural needs as well too. So we work with Bain & Company to help really devise what we're calling a hunger index. And we have it down to the zip code level. And we have a better understanding of where hunger needs are not being met in our 13 county area and what that might look like, because we really do want to focus on equitable distribution of food and ensuring those who need it have access to the food they need. So we can then take that information and then we can decide, is there access to a food pantry there or some other type of food resource that we can connect clients to there? And if there's not, what can we do to try to help grow access to that? So whether it's through a mobile solution, a container pantry model, working with a local community organization or one of our partners that might be able to expand service into that area, it's really going to help us be more effective and efficient in how we're addressing the hunger gap in North Texas.
And Kate and Jennifer, not to put you on the spot, but did you want to add any of the technology piece?
Sure, certainly. The Regional Transportation Council is funding a pilot project from Paul Quinn College to use robots to deliver organic food from Paul Quinn College's urban garden to folks in the community. And this is sort of a two-pronged technology effort because they will also be providing internet access to residents so that they can order the produce via the internet and then have it delivered by the robots. So also, what are the opportunities for using autonomous vehicles in microtransit to help people access food? So I realize it sounds space aged, but I have ridden in an autonomous vehicle as part of a pilot project here in Arlington. So So it is already happening.
Well, Dr. Wong, I saw you on mute. You're going to have to beat robots and self-driving cars. So
Yeah,
you're
that's
up.
a hard one, hard to beat. But just from the technology and data standpoint, public health, one of the core functions of public health. I mean, we look at assessment, assurance, and policy development. So from that assessment piece, that's exactly one of the things we are trying to also invest some of our rescue funds towards building this public health data infrastructure, because as we've seen with COVID, getting that information and using that information both for intervention planning, program planning, and evaluation of what we're doing is so key. And so it's really interesting to hear Trisha's, talking about the hunger index. We're trying to build those data sources also, and look forward to working, sharing some of that information, but using the data community-wide and also linking it to health data so we can start evaluating impact and other health outcomes from some of our interventions, and make them, even business cases for some of these investments, or show how these interventions and activities help save money, through healthcare savings, decreased emergency department visits, things like that. But we're trying to make those data connections as part of our public health infrastructure investments also.
Oh, cool. Jennifer?
Sure. Well, all these are great, and I love the robot pilots and the on demand, and they serve so many functions. A couple of others I've seen, one being kind of the Amazon locker concept that is also co-located in community facilities. We've been told by some communities in the education corridor down near Paul Quinn that they could afford to order online and Amazon Prime and whatnot, but that the drivers wouldn't drive into the complexes, which crosses over with safety. And so, one of the pipe dreams or the pieces in motion is they're very, very close to the new library. And so if you have locker systems set up there, centralized delivery, you have the safe access to your food, and that chain isn't disrupted. And so again, with kind of the on-demand, the last mile for distribution on all access points. And then the second I'll say is Philadelphia has a partnership with Pickup, which is kind of like a TaskRabbit type piece, and they're delivering food, but also internet devices and hotspots so that training can then be put in place within homes. And so in some cases, they'll tack on a TaskRabbit. So if the home needs a repair related to health, related to efficiency, and that grant's been allocated, that TaskRabbit human, not robot in that case, will come in and can do those repairs while they're delivering other critical resources like food and internet. So again, it's about the linkages, which requires technology. And we talk about data, that data software, really the not super exciting stuff about, does the data talk to each other? Is it in the same format? But that's critical to all of us being able to use that data in aggregate to better serve the individual as we try and move them along the continuum.
Well, I find it exciting, even though the data sharing part of it. And what city was that in
Me
again,
too.
that the TaskRabbit? What city?
So Philadelphia is doing pieces
okay.
of it, and they're rolling in the additional elements right now.
Okay, cool. We'll have to look that up. And Kate, I'm going to need some talking points on how to get my kids excited about produce delivery robots, because they were super excited about the Domino's robot, but now I got to switch them to produce because, very different. Gloria, Vice Chancellor Smith, I wanted to ask you, how can businesses and organizations better partner with the workforce and advancement programs that you are doing there? I know that anytime we start talking about the workforce, we have so many business-minded folks on this call. How can we become better partners to what y'all are doing?
So that is a great question, and thank you for asking that. So I want to focus first on organizations and then answer the question about businesses second. For organizations, we know that they are in the community, they are connected with the constituents, and they have built a trust in those areas. Dallas College and our workforce and advancement team, we are working to bring our education and training resources to meet students where they are and to address those needs. Where we would love to really work better in tandem. And we're already attempting to do this with organizations such as Buckner Family Services and some others, is we are trying to get them to allow Dallas College to partner and focus on what we do best, which is workforce and education and training. And what that does is, if you allow us to partner with you and focus on those services, we are hoping that that will allow community-based organizations to revert those resources that they are spending trying to train people to go to work into other services, such as those that will address hunger and, housing and other barriers to just everyday living and sustainability. And so we have some great partnerships we've already established, but we are looking to expand those partnerships and relationships. We want to bring training on site. So if you have facilities where you're delivering workforce and job readiness training, we can do all that in partnership with you. Not to come in and say you're not doing a great job. It's how can we leverage the resources that we have to maximum capacity so we can serve even more individuals. And so as far as business and industry is concerned, I think there are multiple things that they can do. Many of these organizations have social responsibility programs and things of that nature. But I think that the real reality check that businesses have to arrive at is, creating jobs is great. But if you're creating jobs that pay minimum wage, are you really contributing to a viable solution that addresses helping someone move out of poverty or to self-sufficiency? And so I think that, I had an interesting conversation with a major company, and they said to us, we know that we can't keep employees because we pay minimum wages. And our company is looking for solutions so we can move individuals to at least $15 an hour. And so with that, if organizations can look at what their needs are and how they can upskill their workforce so they can pay more sustainable living wages, incorporate health and wellness opportunities for their employees and incentivize them to, learn to practice more healthy incorporate healthy practices within their life, I think that would be, a tremendous effort in helping us move individuals toward more food security, more economic mobility, and things of that nature.
Absolutely. Thank you for all of that. The education and workforce and the development that's going on at Dallas College, I think will be modeled throughout some of the country, because I've learned about so many new programs that you guys are doing, and it's just absolutely fabulous. Dr. Wong, I wanted to ask you, that sometimes with government, there can be some cynicism, especially about 2 decades ago, Dallas County was very difficult to work with. And I know that's before your time, but how has Dallas County become better partners in the past couple of years to really help those that are in hunger crisis or even a health crisis?
I can't speak to 2 decades ago, but we are certainly committed to working with, all the partners in the community in whatever way we can. I mean, we are really trying to, our only interest is the outcomes and making an impact on this. I think that, we've got great partnerships with many of the people, that I'm sure are participating in this, Parkland, and others, and many of the community-based organizations. And so, all I can say is we're committed to that, and happy to hear about any specific issues that have come back, that can help perhaps address any problems from the past. but I can just say, truly our only interest is making an impact and improving this situation. Recognizing that it is multifactorial. I mean, some of the most important things that we can do, raising the socioeconomic status and address the disparities, and from that standpoint, which again involves almost everything we've heard on this session, but including early childhood education, workforce development, other things so that people can also be successful and make a good living and afford things too.
Yeah, and I just want to applaud Dallas County for just even the 10 years. We're celebrating the 10-year here of this coalition summit. In the past years, Dallas County has become so much more open, and the participation in activities such as this, being infiltrated into all those collaborative settings. I really applaud the way that you guys have gone out into the community and do a lot of those needs assessments and be a part of the conversation. So thank you for everything that you guys have done and what you've been able to do in the past couple of years. It's been great. Second to last question here before we get to a couple of our audience questions here. Matt, I wanted to know, what's the single best way for the business community to make an impact and make sure that folks care about hunger and health? Your single one.
Absolutely. I'm actually going to piggyback on something Gloria said, because there's a program that we are working on in partnership with a nonprofit community. It's called Dallas Thrives, and it oversees an umbrella of collective and area institutions that seek to align efforts and funding streams to reach a living wage by 2040 for all residents within Dallas County. Because I do think, as businesses grow, as businesses hire, that living wage is going to be one of the biggest impacts that the business community can do to help rise all ships in our county. So if you haven't had a chance to check that out, I would highly recommend those on the call. Check out DallasThrives.com. There's more information there. We are happy to partner with a lot of the people on this call, especially Dallas College. To the second part of your question, Valerie, I think this is the beauty of social media. You can go on there and directly interact with any business, any organization. No longer are you sending a message and kind of it going into the deep internet. You can directly interact with the communications team from some of the top businesses and really get an understanding of what is important to them, what social issues are important to them, where they stand. And I think by that, you can, one individual can make a better decision of who they want to support, who they want to shop with, who they want to do business with. It's just a lot easier now than ever before.
Yes, I was stuck on a tarmac for 2 hours and 45 minutes just last week, and I tweeted the airline company and my phone rang from the airline company. That type of connection point that you can have and say, I am a customer and I matter. And you can do exactly what you said. I care about hunger and I care about health and nutrition. And I think that you should too. And how are you impacting that? And so, Kate, you get our final question before we get to the audience questions. What lessons can anti-hunger organizations or anti-poverty organizations take from the way that governments practice effective collaboration? What have you seen that we could all do better, right?
Sure. Well, so the Council of Governments' role is as a facilitator. It's to bring our more than 200 member local governments and transportation entities together to bring those ideas together and to kind of leverage the power of all of those groups. And so what we really need to do is more of what we're doing today and creating communication between government and hunger organizations to try and find solutions to this problem.
Sure. Collaboration is the key and the theme for today, right? We cannot do this alone, especially in such a multifaceted way. So I wanted to get to a couple of our audience questions here, and let me go look at some of those. So Mr. Garcia, what is the priority for chamber members as far as how to attract a healthy labor environment, or what's led the chamber to be supportive in these issues?
That's a great question. I think more than ever, you're seeing a competition for talent, and you're having to understand the needs of your employee base, your talent base, and a healthy workforce is at the top. Without having a healthy workforce that can thrive, that can access healthy foods, you're missing out on a whole portion of the talent pool that would really help all businesses thrive. So it is a top issue for us at the chamber, and it's one we're going to continue to work on.
That's wonderful. Based on your organization's mandates, missions, and lessons learned from COVID, can any of y'all speak to incorporating local food into the food system? A lot, I know that it was brought up, I think, Jennifer, you brought it up, that we now have this North Texas Food Policy Council that Stephanie Bird and I are very honored to co-chair. And one of the items we want to look at is kind of a food shed map. Where is the food coming from that our residents are eating? How much of it is from the outside and how much of it is from the inside? So I'm just wondering if any of you want to take that question. What's a better way to increase local agriculture into our food system? Danielle?
So I guess for me too, just experience, right? But the way to introduce more local food into our food system would be to support those local farmers who have otherwise not have the opportunity to plant and to grow and to have somewhere to give the food away, right? We work with some farmers who literally threw a lot of their harvest away because they had no avenue and way to move it. So transportation is also, so market and transportation is also very critical. So for me, it's about how do we give resources and open up resources for those local farmers to know that if I take this chance to plant this food, I have a way to get it to the people who need it, right? Which means refrigerated trucks, and knowing that they have a place to distribute the food. So to me, I think that's a way is to make that investment that they need and really assess the needs of local farmers. What do they need to really plant? Whether that means they have to hire, labor to do that work, transportation, etc. So that is a way of introducing more local farmers because they're there. They just don't have the resources to do it.
Okay, that makes a lot of sense. Trisha?
Yeah, I just wanted to mention a couple of things overall because, nutritious food is so important. It's not just important to have something in someone's stomach, it's making sure they have nutritious food in their stomach. And almost half of the food that we distribute here at the North Texas Food Bank is fresh fruits and vegetables. A lot of people are surprised by that, but actually that is our focus and that's what we want. So obviously we need that supply of that. Some may not be aware of the surplus ag grant at the state of Texas level that they have implemented to ensure that we can get those seconds and blemish product that's still perfectly nutritious that would normally be tilled under or be thrown out in the manufacturing process to food banks so that we can distribute it to the food pantries and get it out into our community. So we have just really loved that program and it's really focused on Texas farmers. And that's the whole purpose behind it. We were able to keep that reinstated in this session this year, but we actually could use that to grow. And so that could be something that our community could do is try to make sure that Texas farmers have access to those funds to be able to go ahead and bring in that product and be able to get that imperfect produce out to food banks so that we can distribute it. The other thing too is I think putting knowledge into the hands of those clients that need it. I know here, and there's so many other programs across, and I know, Reverend Ayers, you've talked about this as well too, but helping people to understand how do they grow food and how do they get that food? And so we do have a community garden program here at the food bank, and we have a gardener that they connect with the local community gardens. And there's probably 25 to 30, there should be 300, but there's 25 to 30 across the 13 counties that they actually have people in the community that grow produce. And as a commitment to that garden, they agree to take a percentage of that and give it to one of our local community food pantries so that they can have access to some of that. And if we had more of those starting up and more percentages of those food going into those food pantries, that will also help us to increase those local agriculture as well.
Oh, Jennifer?
And so just two quick things. One being, we talk about the impacts of climate change on the ability to successfully increase food production, and some of the complications there, but the ability to, on my technology side, to be able to use new tools like Internet of Things and smart irrigation and agriculture that really helps one to create more consistent food production and growth, and also to increase yield, provides not just increase in business development or community gardens, but really also provides training opportunities for youth to get that experiential learning into future careers around the technology space while increasing production. So that's one way to integrate some of these pieces. The second one is an idea that I have that I'm just going to throw out there in case someone on the phone has resources to do it. We talk a lot about farmers being able to get their produce to where it needs to go, and the refrigerated trucks, like Reverend Ayers mentioned. And there's a lot of logistics hubs here in North Texas, and grocery folks and distributors. And we had an idea for using sensors to look at excess space on those trucks, and could that space be allocated to local farmers, local production facilities, so that the logistics costs, which is one of the highest costs for either local grocery stores to get those supplies, or for local farmers and producers to physically have a business that can exist. So if there's excess space on a truck, can we do a pickup there? Can it get where it needs to go? That obviously requires partnerships and looking at that supply chain, but that's something that I would love to pilot. If there's any grocery stores or producers or anybody on the line that wants to try something new, I think that could be helpful locally.
Right, full loads out and full loads in, right? It's the best way to get that supply chain and the logistics out there. It looks like, oh, Bob Curry, you're asking, speaking of watershed and whatever, of this, I'm trying to frame your question the correct way. So we saw a major reduction in food insecurity when the first COVID checks came out. And I think, especially those that were doing direct service, we did see that. And as child tax credit checks are getting mailed out to folks, the US Census Bureau just released their poverty data, and the USDA just released their food insecurity data. And we see that the giant spikes that we thought were going to occur didn't really occur, thanks to a lot of the government interventions and the charitable food network. So he's basically asking, what is the best way to address food insecurity? Is it through these state agencies and government interventions, or is it approaching it from the more holistically grassroots organization, or combination of both? I read a lot into your question, Bob. Hope that's okay.
Okay, I'll speak up. I'm
Okay.
never shy. You know that, Val.
Yes.
But, I really think this is a very complicated issue. And I think all of you here on this webinar understand that, because, we're all in this fight against hunger. There's so many different elements. I don't think there's just one answer. And we can certainly provide the food. And that's what we've done during the pandemic. We provided food. The government provided stimulus checks. They provided the resources. But I think where we're going with our new strategic plan is also, in addition to using our core competency of food, is how do we get people beyond their issue of food insecurity? Because that's the only way we're really going to have a sustainable impact on food insecurity, is to address those root cause issues and that are tied with poverty. Hunger is a symptom of poverty. And so we have to address those poverty issues if we truly want to have a sustainable impact on food insecurity. We can access the food, and we can put these Band-Aids on to make sure that food insecurity is reduced. And certainly that's what we're committed to at the food bank. But what we would love, obviously, is to go out of business, or to reduce the number of meals that we have to go out in the community, because that means that real impact has happened by reducing that. My 2 cents.
They're a good 2 cents. Let's see, the next question we have here, Shmuel has asked to be asked, according to anyone's opinion, the impacts of the COVID-19 pandemic on future ways of, let me read it really quickly. So the COVID-19 pandemic showed us multiple impacts into multiple sectors, right? We had the job loss, we had temporary job loss, and as eviction moratoriums begin to disappear and government intervention disappears as well. We talked about the losing 15% increase, possibly maximum benefits. We don't know if those are going to stay around much longer. Are we going to have more long-term state and government intervention to process hunger, how we're treating it? Or is it time for the charitable community to swell up and go that way? My 2 cents, even though you didn't ask me directly, is that it's going to have to be done together because the problem is so massive, right? It's not something that we can do. I would love to take anybody's other thoughts or add on to that on how the pandemic is going to increase the role of government intervention into, let's say, the next decade. Let's see, Matt, I'd like to get your perspective on what you're seeing in the business community of the long-term COVID impacts that businesses are. We saw so many businesses shutter, right? And so many survived thanks to that government intervention. What are we looking at a decade out?
I think it's still a little too early to tell. I think here over the next 2 years, you'll see probably that partnership of the charitable community, as you mentioned, and the governmental community. Those funds continue, because as Delta continues, and if there's another variant on the rise in the near future, I think a pullback in one of those right now would be very detrimental. So I think here over the short term, you're going to see that. Over the long term, it still remains to be seen, because that's one thing about the business community. They're very adaptable. So how do they react and continue to evolve throughout COVID is one that businesses found a way. Part of that was through government intervention, as you mentioned. Another way was just evolution, filling a need. That needs arose during COVID, and we're going to continue to see that. So I think probably here over the next 6 to 8 months, we'll have a better insight to what they may look like.
For sure. And I see that there's one final question in the chat about SNAP and WIC. If you want to go ahead and send an email to any one of us, be happy to answer that for you, because we could actually do a 2-hour session on what the hurdles are of enrolling folks in SNAP and WIC. So go ahead and send an email, and we're happy to address that. As we wrap up here, I'm going to hand it back over to Stephanie, but I just want to say thank you to all the participants. I mean, where else at the height of this, we were at over 160 people. Can you get so many folks that care about this subject in a shared space and have such amazing dialogue and hear from the experts for all of it? So it's been a week. We started this week celebrating the heroic bravery of so many of our first responders because of the September 11th anniversary. We worked through issues that we've all had. How can it possibly be September already and all the things are becoming due? Happy Hispanic Heritage Month. It begins now. And Shana Tova to those for the new year. And thank you all for your time and those for listening. So Stephanie, I'm handing it back over to you.
Well, thank you so much, Valerie, and to the panel. Just a virtual round of applause to the panelists. This was such an informative discussion. Great questions, Valerie, and also from the audience. Just once again, if we could give a round of applause, I just want to, from behalf of the Dallas Coalition for Hunger Solutions, just want to thank again our esteemed panel, Trisha, Dr. Wong, Gloria, Reverend Ayers, Jennifer, Kate, Matt, thank you all. You really helped us to think differently about how we might address poverty and hunger. And we look forward to working with all of you and our attendees today to really address food insecurity. So thank you so much. And Valerie, amazing job. Great questions, pulling information from what's been said, and really keeping us engaged today. Really appreciate you serving as our moderator. If you enjoyed today's conversation, make sure that you are registered for our next 2 webinars. We have a webinar next week, September 24th. Can you believe it's already the end of September? It's called Ending Poverty to End Hunger in America, a Roadmap. Our host is Beth Dexter with Parkland Foundation, and KERA News's Courtney Collins will interview co-authors Joanne Samuel Goldblum and Colleen Shaddix on how we end poverty in our society. And then in 2 weeks on October 1st, Our last and third session is called Addressing Food Insecurity and Healthy Food Access, Dallas Area Initiatives and Best Practices. Hopefully you're already registered, but if you're not, we encourage you to visit eventbrite.com and search for Dallas Coalition for Hunger Solutions to sign up for these sessions. Before we close today, there are a few more people I'd like to thank. The planning team for today's session and the entire summit. A huge thank you to Beth Dexter, Catherine Nicholson, Kristen Chan, and Mark Edwards. Amazing job, really helping to identify the topics and the speakers and really coordinating everything. Kudos. And then today we have Edna's Province. She is managing the technology for today's event and for all of the sessions. So thank you, thank you. And a huge shout out, as always, we are so appreciative of Wynella Henderson Green, our coalition specialist. She makes sure she keeps us organized, and she also helped to organize the Hunger Summit, this and all of the Hunger Summits. And she also keeps our collective work on track all year long. So thank you, thank you, thank you, Wynella. We would be lost without you. And finally, a kudos thanks to all of you attendees. We really appreciate you being here today and your commitment to understanding the social and economic challenges that our neighbors face. We appreciate your concern for improving the access to healthy food and hope you will join one of our coalition's action teams to help us make great strides in ending hunger and poverty. Now look for information about our coalition in our follow-up email. And then upon leaving today's webinar, you should receive a brief pop-up evaluation form. We would appreciate you completing this form, and it is very brief, but tell us what you've learned, how you want to help, how you want to get involved, and what you'd like to learn more about. Thanks again for joining us today. Have a wonderful Friday and a wonderful weekend. Thank you so much, everybody.